Hello and welcome to the Canine Rehab Movement Podcast, where we discuss all things canine rehab, fitness, and sports medicine for our four-legged companions. We cover a variety of topics with amazing guests in an educational and entertaining format. Some would even call it edutainment. Now, we are all about canine rehab and fitness training, or craft. So join us and hone your craft with the Canine Rehab Movement Podcast. I just wanted to take a hot minute to talk about something that can make a big difference for both you and your furry friends. This episode is brought to you by Multi-Radiance Medical. Multi-Radiance lasers offer the most clinically valid light-based solutions, built with your patients and practice in mind. Multi-Radiance's unique superpulsed laser technology safely delivers the most light to deep tissue and facilitates absorption to accelerate healing and reduce pain in pets. Treat animals in the clinic with the high-power ActiVet Pro series. Then, continue treatments in the comfort and safety of their own home at their schedule with the MyPet Laser 2.0. Visit vet.multiradiance.com today to learn more and schedule a demo for your practice. Hey guys, it's your host Anthony Schena, CCAT, CCHT, and owner and founder of Alpha Animal Rehab and Fitness. Now on today's episode, we have an esteemed guest, Dr. Hannah Capon, who is an award-winning UK veterinarian and founder of Canine Arthritis Management, or CAM. Known globally for her tireless work in raising awareness about canine arthritis, Hannah has transformed CAM from a simple Facebook page into a comprehensive education and support platform for dog owners and veterinary professionals. With a robust online presence, engaging campaigns like #YourDogMoreYears and collaborations with industry leaders, Hannah is reshaping the way we approach canine arthritis care and well-being. Hannah, thanks so much for joining us today. So yeah, let's get into it.
Okay, it was nice to meet you guys. It's a little bit of an obsession of mine. And I think we probably could do it in some kind of key take-homes rather than me waffling on about pathology of the joint. But it's the most common musculoskeletal condition. It's highly prevalent across multiple breeds. It's predisposed in medium to large breeds, but I think that's probably because we don't actually detect lameness in small dogs as well as we do in big dogs.
Yeah.
It's majorly caused by developmental joint disease in dogs. We're still not aware of what's happening in cats. There's possibly an immune-mediated inflammatory component. But it means that as a practitioner, a first opinion practitioner, you're going to see it every day, all day, every day. Because the figures that it affects are huge. Now, in about 1997, people were believing it was around about 20% of all dogs. And that was done on a phone survey with vets from, I believe it was like North America. However, in recent years, it's just been going up. We can talk about why that is and possible causes. But the figures now stand at around about 40% of dogs of all ages. So that means that you're seeing it probably one in two, 1 in 3 consults if you're working in first opinion practice.
Yeah.
Which therefore really tells us that we should be doing it. We should be amazing at this.
Right.
You know, this should be just the thing that we're pinnacling on, but we're not. That's the sad truth about osteoarthritis. Just to clarify, it's a degenerative joint disease. We're not dealing with the immune-mediated. It is a localized inflammatory condition, and it leads to complete joint failure. I'd love to be the person that be able to recite exactly what happens with the interleukins and the MMPs and all that exciting stuff,
Yeah,
but
right.
you're not going to listen. So let's just cut to the chase. It causes complete joint failure. And I think for all of us, we've got to realize that our dogs are amazing beings and we actually don't detect it till quite progressed condition. And I'd even say that we're not actually detecting it until it's a welfare concern.
Yeah.
And that's possibly a bold statement, but I believe it's true. So we tend to pick up on it when it's become more persistent or the acute flares are really quite dramatic and we've got the consequences, we've got the physical changes, the emotional changes. So it's already had quite a long time to develop.
Yeah.
And that's an area that we can talk about, how we're going to improve our earlier identification.
I agree.
Yeah. And I think when you actually really distill down, you do sit there in this kind of silent, cold room of your mind going, how did this happen? We're so good at vaccinating. We're so good at all our parasiticides. We're so good at all these other screening and preventative health, but we're completely letting home goals go in with this one. And I think in my lifetime, I'd just like to think that we're going to be way more on it, catch it early, be able to have conversations about future owners, the choice of breeds, the lifestyles, their expectations. And I hope there's going to be like a rehab section to every practice in the whole world.
I mean, I agree. I'm all for that as well. I want to be someone who can help create that awareness and that abundance of rehab. And unfortunately, I do think we're still on the reactive side instead of the proactive side with rehab. And it is unfortunate because I do think it's an awareness problem as well. But yeah, there's definitely things on our side that we can do to become more proactive instead of reactive, instead of waiting for the patient to come in that already has that discomfort and pain that we know it's already too late and has progressed and could have prevented it sooner. With little telltale signs and things like that. But I absolutely agree. I hope this flourishes into a more proactive state for sure.
Yeah, and it's possible. Just doing some kind of silly analogies of possibilities. When I was training, dogs wore collars. Now they all wear harnesses. And that's in the last 2 decades.
Yeah.
It's a complete change of attitude towards something that we just do. And I think that there's going to be hopefully a change in attitude to something that we just do, which is bringing in musculoskeletal health checks, having conversations with the caregiver when the dog is young about the signs to look out for. I think it's all possible. It's on our doorstep. It's just now rallying the troops and getting them confident to have the conversations.
Yeah, no, it's absolutely true. And I think the biggest thing too is trying to, even as a practitioner, the younger practitioners especially, we all have a mindset of we know what we're doing, but maybe even for our listeners now, going over how we truly recognize the signs of arthritis in dogs and the importance of early detection.
Okay, yeah. I have my way of doing it. Doesn't mean it's the right way.
Yes, of course.
Yeah. So first of all, I think we really need to be taking some note of the amazing work that was done with Coast. So they brought in the Coast staging tool where they really acknowledge that there is stage 1 where these dogs are predisposed. They may not have it, but they're predisposed because of their genetics, because of their lifestyle, because of their body weight, whatever it might be. And I think as a practitioner, being aware of that, going, right, dog that's just walked in, what breed is it, what age is it, what size is it, and what does it do? And then you can start thinking to yourself, you're likely. And then I am listening to caregiver's narrative because let's be honest, physical change doesn't happen overnight, but emotional and behavioral change will. So you will have people saying, oh yeah, he's just not himself, or he doesn't do what he used to do, or he started doing this. So I'm listening for these little kind of gems, these little kind of conversations that they might just drop in passing. Oh, he's become a bit grumpy with other dogs, or he doesn't like his feet being handled anymore. And I'm just making sure that I really do listen to their observations, because let's be realistic. I only see the dog for 10, 15 minutes.
Yeah.
And then I always make sure that I'm observant, and I try to kill 2 birds with 1 stone. I want the client to like me, but I also want to watch the dog. So I'll go and greet them in the waiting room. and I'll walk backwards. I'll be keeping my eye on the dog. The owner thinks I'm just the kindest person in the world because I've come to greet them, but I'm actually going, no, mate, I'm actually watching the dog.
We're
So you
assessing.
can watch, yeah, so you can watch them transition. You can look at their gait. You can look at their behaviors, their postures, the way that they react to the world around them. And then that continues once you're in the room. And I'll always say, hey, the door's closed. You can let the lead go. Let them just have a mooch. Let's catch up. And that means that you can watch them moving without restriction. Hopefully they start feeling a little bit more comfortable to mooch around, investigate the surroundings. And you can get some more kind of like hints and tips from that. I always work on the floor. I don't like working on the table, even with cats, and to work on the floor, because I just think that once we put them on that table, we take away their rights. They've immediately become stranded on an island, and they're going to start being more kind of defensive and protective and vulnerable. So I'll often pull out a little mat. I quite like having half-size yoga mats in everywhere I work. And that does a number of things. It's saying to the owner that this is important because I'm taking the time to do it. Gives the dog traction. That's an island to work around. The island has got many exit points, so the dog can actually choose to leave if I'm examining and they feel that they can get away. So loads and loads of things like that, but I'm trying to lead by example. And then I, in my head, have this thing called the suspicion of chronic pain diagram, which is a CAM tool, where it's like the X factor, but you've turned it 45 degrees. And at the top, you've got behavior change. Over there on the left, you've got posture change. At the bottom, you've got physical changes, like coat muscle changes. And then on the other side, your capability and gait changes. And in my head, I'm like ticking stuff off. I'm like, oh yeah, that one's up there. Yep. There's a bit of change down there. And it gives me a tool that I can then talk to the owners with. So I'm collecting my confidence data to broach the topic of, hey, you said he doesn't greet you at the dining room. Physical changes, coat changes, he's not moving quite well. I have a real suspicion that we've got some underlying discomfort that we need to uncover. So that's how I do it. And I guess for me, I'm quite confident to talk to the owner. And by using that approach and that tool, when they may question me, I've got the evidence. It's there. It's in my head. Quickly jot it down. So that's how I tend to do it. And I tend to have that attitude with all ages of all breeds.
No, it's very cool. I do that approach for sure. And I do like how you get down on the floor. I do the same in my facility because I do think the table, like you said, is an island in a sense. And they'll feel isolated, and I'm a big fan of the floor because I use it. We just use like padded mats and everything like that. So it's a little more comfortable, not so hard, things like that. But yeah, I think your approach is really great. And I think obviously with every patient, with every day that goes by, that approach gets seasoned a little bit more too, right? We're always learning from each patient and always learning from each other. So some of those approaches, especially when you have that kind of evidence base to give that pet parent or client an answer like, this is where we're at, this is why. And that's super important, right? It shows also just the value of rehab and the value of the treatment that's about to be done for the patient in front of us. And a lot of times we can get undervalued or misvalued.
Yeah, definitely. And I think I know the question and the concern that's posed to me the most, be it via email, messenger, Facebook Lives, in person, is through the veterinary profession and allied professionals saying, what about owners that don't believe you? And when they don't, they can't see it. And when they think that you're making it up. And I'm like, the journey and the collection of material that you can really easily recount and you can draw in a diagram and you can show them, that answers that problem. So when they defensively challenge you and say, no, he's fine, he's been fine, you can say, well, just let me show you a few things. You told me this, I've palpated this, let's look at him together. And then, okay, I see where you're coming from. Yeah, there's a few things there. And then you can go on the journey together thereafter. It is a very shared decision-making journey. And I don't have the intention to try and get everything nailed in first hit. I know I've got to go at their place as well.
Yeah, no, for sure. There's, even especially on the first visit, right? There's all these test and measures we're doing, all this assessment, all this education. And then I always say that it's not just acclimation for the patient, but also for the client, the pet parent. They also have to acclimate to what's happening now, the environment, how things are going to proceed. There's behaviors on both coming off the patient and the client as well. So you need to make them feel comfortable, give them all the education so that they can make a educated answer and way to progress and value what we do, for sure. Yeah.
Exactly.
Yeah.
It's a big problem. It's a big problem. I was just driving today going, wow, 10 years now, Hannah, that you've not let this one go. It's like I'm a rabid beast hanging on to tales of osteoarthritis. And I can't let it go. And I'm sitting there thinking I can listen to any podcast. I can learn about liver disease, ophthalmology, I can do anything. Going back into practice, I should learn about other stuff. Put on a pain and an OA podcast. There's so much to be done about.
I was going to say, it's so prevalent though. So you don't definitely want to push it aside. And if you can attack it or be somebody at the helm to attack it head on, I applaud you for it. I'd say keep your concentration, keep your focus, because it's something that was only going to grow, unfortunately, right now. And it happens to the best of us and them.
Well, it is great.
Yeah.
So we might as well talk about this concept that more and more percentage. So is it more cases? No, it's not more cases. There's a lot going on. And something I think very interestingly, we've got the change of social structure. So we've got caregivers that have different expectations, different lifestyles, different wants. We've also got an industry that's beginning to wake up to it. And we've now seen all of these developments in rehab technology and diagnostic imaging and surgical interventions. And that leads me on to, we've got an industry that is making millions and it's set to grow. So the projections from I think it was called Future Markets Inc. I was having a look, and it's at the moment sitting at something like about 4.8 billion global market. And in the next 3 years, it's going to go up to 5.2 billion. You know, it's an interesting time. And if you want to be like really positive about it, let's be positive. Let's not be cynical. Let's be positive. Everybody is the winner. When you put it like that, everybody's a winner. So we've got these dogs that are going, I don't care who's making the money, but can someone listen to me?
Right.
And we've got caregivers that are saying, there's something wrong and I don't know what's wrong and I want him to live as comfortably as possible for as long as possible. We've got us, the veterinary profession, going, I want my job to be interesting and I want to go home at the end of the day feeling satisfied. And then we've got our employers going, I love the fact that you love your job, but you're going to have to earn me some dosh. So everybody's a winner at the end of the day.
Truly, truly. And I think the most important thing is, as long as there's an abundance of awareness and resolution to, figuring out what the demographic wants. It's as long as there's the education there too, the whys of going this route, going that route, or not going any route, right? So I feel like as long as that's all out there, let's look at the bright side of things. Everybody, from client to professional, can make an educated answer on how to move forward with the patient in front of them, right? I think that's what the most important thing is. And if that is out there, and I am seeing it, but for me, I'm somebody who says there can always be more. There can always be more awareness. There can always be more education out there. My hunger on that end is not satisfied, but it's getting there. And we're seeing it day after day. And I truly agree with that for sure.
Yeah, unfortunately, we've got to work out how we can raise awareness. And then goes back to this social structure. I've been battling this for years. How do you get awareness? And okay, let's go really mainstream here, because you go on YouTube and you look at an educational YouTube video and it'll have 72 hits. And you'll go on and you watch a golden buzzer moment for American's Got Talent. It's got 6.2 million. And you sit there thinking, wow, that's not life-changing. That is. How can we grab some of what they do to really raise the awareness of what we do? And that's the sort of thing I'd love to be able to play with that.
Yeah, I hear you on that. And that's an answer that's ever evolving. Do we use influencers, right? Do we try to make something that is educational more entertaining, but still putting that educational message in there? Because I think we know for the majority of all these platforms, especially the social platforms, people are looking to be entertained and escape from reality, right? So education's great, but entertainment it topples everything. when.
And I think many of your listeners will probably resonate with this. I used to do lots of like fairs where you'd go to a country fair and somebody would say, hey, look, I've got a stall here. Would you like to come and bring canine arthritis management? Because we know you haven't got much money and you can tag on.
Yeah.
And I used to do it. And then I realized that people don't go to fairs to hear bad news. They go to fairs to be entertained. So for me, it was always very demoralizing. It's not where I pitch my energy anymore.
Yeah.
So yeah, we've got to work out where that balance is. For me, I think I would really love to have the opportunity to grab that caregiver when the dog is a pup. Because that's when you hear phrases like, what's the best harness? What's the best bowl? What's the best food? What's the best insurance company? What's the best dog pup? What's the best dog walk?
Yeah.
And everything has to be best. And you're like, that's when I'm going to get you. And I'm going to teach you to recognize the signs of pain, because that's the best way to keep your dog healthy for as long as possible.
That's very true. And I like it. Now you got to find the approach, right? How do we get there?
Tom Hardy. Tom Hardy is the approach.
Okay. Perfect. I love it.
Tom Hardy with puppies. Amazing.
Now we just have to execute.
Yeah. I've been thinking about how I can crowdfund this beast.
But going back to, like you said, you used to go to fairs, and I would do community events as well. And you could just see it in the eyes of people that they're going there to be entertained, to do things that they're not normally doing throughout the week. That's creating whatever. And so I always found myself trying to do like the educational entertainment where I do a little snippets of this and then have a video right away of, oh, look how fun this is. Look how cool this is. And then going into the background and science of it real quick and then moving on to the next thing. I think attention deficits are there too, right? Like they're only going to give you so much amount of time for the educational, but they will stop and watch a dog in the underwater treadmill for 5 minutes. You know what I mean?
Yeah. This is another area. And like over here in the UK, we have something called Dogs Behaving Badly. And it's like a series on TV, and people like to see change, don't they? It's like women like to see women that have gone from 120 pounds overweight to fully made up, slinky slim with a new wardrobe. People love change. They love to see these transformations. And Dog School and Dogs Behaving Badly is about transformation. Just imagine if we did one about rehab and transforming these dogs from that to this. And people would just be like, wow, is that possible? Yeah. So that's another idea. That would be, come on, someone help me.
Right. We need to find the person that can put us in front of the right set of eyes. Yeah. But that's the challenge. And I think it all stems from the discipline itself. How do we get it out there, starting from general practitioners, even as a puppy, right? Like you said, I think general practitioners too, when they do like a puppy checkup and a puppy wellness, maybe that should be on the list, right? Here's X, Y, and Z. Here's this and this. And even if it was just a little pamphlet, just in case this is something you might be interested into, how you can, tell if there's pain or this or that from the puppy. And I even try to instill at my facility, we do puppy education and puppy conditioning. And I feel like that helps a little bit too, but still, the crowd that I get is just not enough, because I think I get a very small percentage in the comparison of all the puppies that are in my local area. But even that, it can spark something at least. So if we can start at the general practitioner where everybody brings their puppies, if they get a new puppy, whether it's a rescue or anything else, they're going to bring it to a GP first. And I think that's where we can get that information, and that's where we can at least start. I think there should be a really great trickle down effect there, but it needs to become a norm, unfortunately, and it is not.
It does, but also we need to deal with the other problem, which is really prevalent, which is, say you detect pain early, what do you do? So we have got a world of hurt we're going to have to navigate over the next decade, which is, okay, let's identify these cases early, and we're going to be more aware that it could be behavioral. So we've got dogs that have started getting a bit tiffy with other dogs in the park. You come in and you examine them and you go, I think it could be a little bit uncomfortable here. I think there's a little bit of resistance to me flexing the elbow. I think there's something that could be. And I'm going to persuade them to do some diagnostic imaging. And It's not really very obvious, is it? So what do I do? And I think that's something we've got to take really seriously is practitioners don't know what to do. Whereas when it's overt and the signs are clear and the owner can see it, then you become a little bit of a magician at the beginning, don't you? Because you get this dog that's been slowing down, you put them on an anti-inflammatory and the owner's like, this dog didn't know it was going to be like that. And they get that trust relationship with you because they've seen dramatic change and they're like, she knows what she's doing. I'm going to go back and see her. But when you've got subtle that they didn't really see anyway, and then you're talking about doing quite life-changing interventions such as, I don't want you to really throw the ball anymore. And we're going to cut back on him jumping out of the SUV. And I'd like you to go and see a rehab person once, twice a week for the next 8 weeks. And it's going to cost you 10 times the amount of money you expected to spend. We're gonna have quite a lot of difficulty in the next years, I'd say.
Yeah, there's definitely resistance there. And I do think, especially when a lot of clients can wind up investing in pet insurance and some things are obviously, depending on when they get it, there's pre-existing and those things don't get covered. At least in the US, you can get health insurance with pre-existing conditions. And I think if there's a change there too, in that kind of sense, especially in the US, our demographic here is insurance helps, out of pocket doesn't, right? So if we can get to a happy place, especially with the pet insurances, and yes, there's a lot of dogs that unfortunately have pre-existing conditions. So the pet insurances, they were only going to move forward, whatever happens now. And if it's part of that region, it's not going to happen. So if we can get to them too and say, listen, why don't we do this and this and follow this pathway and we can help more dogs, right? That's what pet insurance is for, right? Helping more dogs or animals and things like that. I think there's a lot of work in so many different categories.
Yeah. And I think we could actually tangent from that quite nicely into my area of love, which is what about all the interventions that don't cost money? And I think I say this like with sheer honesty. I came from a very normal background. My mum and dad worked very hard. It was very low to moderate income. There was 4 children. My dad was a builder. And we had the family Labrador, and both of our Labradors, Bruno and Lancer, made it to 15, but they wouldn't have had expensive diagnostic imaging. They wouldn't have had PRP in their elbows and hips. It just wasn't going to ever happen. They did end their lives on a non-steroidal, what I remember when I was a child. But I think one of the big drivers for me about CAM is to make sure we have provisions for everybody. And there are going to be a huge amount of people that don't have insurance. And we know that from a study that was done many years ago by John Innes and his team. They put out a radio poll to get people to sign up for them to create the Liverpool Osteoarthritis and Dog Studies. They were actively recruiting caregivers of arthritic dogs. And 33% of the people that kind of signed up were at vets. The dog had been diagnosed and they were on a treatment plan. And 33% were registered at vets, knew that there was a problem, but were choosing not to be seen. And there's another 33% knew there was a problem, weren't going to the vets. So for me, I'm really aware. My heart and soul is with the dog initially. I want to make sure that we cater for all.
Yeah, no, I agree. And I do think as each day goes by, there's a different mindset on pets being pets and pets being more of the family now. And they want to invest in them like they would any other family member. I think that shift is going to help in the long run as well. I remember 20 years ago, people saying a dog is a dog, right? What's wrong with it going into a doghouse outside? What's wrong with feeding it scraps? And that's what dogs get. Give it kibble, give it scraps. So mindsets of health, the food we put in them now, right? And the environment that we give them, that's changed drastically just in, I think, the 20 years that I've seen from pet ownership. And I only think it's going to keep going in the right direction when it comes to environment and healthcare for dogs, nutrition for dogs, things like that.
I agree. In the Western world, in the developed world, I think there's still many countries where they're going to be quite behind. I think smooching around Morocco at the moment, and I've been in Spain and Portugal back into France and stuff. And
Mhm.
you look, and dog ownership is very different around the world. And we are from extremely privileged countries, both me and you. My dog, I've got 3 now, and they're all
Mhm.
insured up to £14,000 per year. It's a hell of a lot of money. My last dog should have liver surgery. It cost me £10,500. And I'm able to do that.
Yeah.
That's my priority. She's my child. But there are many people that can't. So,
Yeah. A lot of problems that need resolutions, but I think if right people get to it, the right awareness is created, I think those can be somewhat met or at least talked about a little bit more, for sure.
Yeah, that's the exciting thing about us detecting the disease earlier. So let's float around in the clouds of possibility.
Yeah.
So we've just had a Rottweiler pup turn up, and she's had her vaccines, and she was great. She was great at 9 weeks. She was great at 12 weeks. And she came in for her monthly health check with the nurse who was just putting on the weighing scales, checking that she stuck to the puppy growth charts. So she wasn't putting on too many pounds, and behaviors were being influenced, and the owner was being guided. It comes to around about the 4th, 5th month, and the owner noticed she's just starting to be a bit chewy, and she starts being nibbly and being a little bit difficult, just not being it. And then we go, oh, behavior change. Get this checked out. And we realized that she was actually showing a little bit of discomfort, be it elbows, be it hips, pick one. And ideally, we will be able to, low cost, really influence the case by talking to them about lifestyle, talking to them about exercise, talking to them about weight control, talking to them about nutraceuticals, talking to them about using anti-inflammatories in a more intermittent, kind of targeted fashion. So we could cater for these people that have less financial availability, but we can also cater for the people that have major financial availability. And we're looking to, do stem cells fit in at this point? Is this where we can actually really change the tide of what's going to happen? Again, I'm trying to be Miss Positive today, aren't I?
Yeah, right. I love that you bring up stem cells, though, because I do think that is something that can really expedite in rehab as well. And I think it needs to be talked more about, and definitely more of an option to be given out. Obviously, I guess to say even more affordable, we can only hope and dream so much. But yeah, I love stem cells. I love PRP. I love stem cells because I've seen such, in rehab, such bounce back when you're able to have that aid and that help and be able to, push the dog a little further, right? Or push the patient a little further. And now because you were able to do that, their rehab, their recovery is, you're almost shaving weeks off of it in a sense, right? And these patients are getting back to what they're doing. And in a sense, I love to see it. And the only downfall is that the quicker they get better, the more education you have to give the client or the pet parent, right? Because they just don't know about tissue integrity, tissue healing, all of these things, right? So yeah, the dog's looking great, right? Been doing it for a few weeks with the stem cells, PRP, and rehab, and the dog is looking amazing. But they don't know about tissue healing. So they're going to let their dog do what they used to do. And then there's so many setbacks there as well. With this advancement of the stem cells and the PRP, I just hope it becomes more of a norm as well, because it's just so helpful. It really is. I love it.
Yeah, I agree. And I definitely love the fact that our toolbox is expanding.
Yeah.
I'm acutely aware that we still don't know when is the most appropriate. We still have got a lot to learn about them, because I can remember when stem cells arrived and everybody was like, oh my God, it is the holy grail. This is incredible. And then I can remember a couple of years later, people were like, look, it's just a really expensive anti-inflammatory. That's the one we're using. And I think we've got a lot to learn about it. And I also hope that we don't see it as a quick fix, a way that we can continue the poor lifestyles. And also, I don't want to be a one-trick pony. And I think, let's be outrageous. I think Librella's doing a real amazing things, but I'm also thinking it's doing some damage. I think it's turning a lot of practitioners into one-trick ponies.
Yeah. I think the biggest thing is the world needs a hybrid of medical and rehab, right? I don't think there's just that one Band-Aid, right? that's going to fix it. There's no miracle Band-Aid, right? It's just not possible. And I know these injectables that are out there are sometimes called miracle drugs and things like that. But in the right scheme of things, I always implore any client, do your research on it, on what exactly it does. And I can explain how rehab can help in conjunction, right? Because I don't just want to, I always like to give options for people. So I'll talk about anything they want to talk about, whether their GP brings up a drug like Librela, injectable like Librela, and I will gladly talk to them about it and have the transparencies of the positives, the negatives, and how it should be in conjunction with rehab, right? Because what it's doing and what... Hey guys, I hope you're enjoying today's episode of the Canine Rehab Movement. I just wanted to take a hot minute to talk about something that can make a big difference for both you and your furry friends. This episode is brought to you by Zomedica. And at Zomedica, they are committed to meeting the needs of clinical veterinarians and rehabbers in the ways that promote both patient and practice health. Their mission is to advance the effectiveness of veterinary practitioners and rehabbers by offering innovative, unrivaled products and services. Now, as someone deeply involved in canine rehab, I know how important it is to have reliable partners. That's why Zomedica's dedication to innovation and quality is so valuable to our community. Check them out to see how they can help enhance your practice and improve patient care. So thank you to Zomedica for supporting our mission to keep our furry friends healthy and active. Okay, now let's dive back into our discussion. Rehab and what it could help rehab do. So that's where I lead the conversation. I think that's where the medical side of things, like I was saying before, really needs to have a positive idea about rehab and trying to combine it with what they're offering on that medical side as well.
I think that there's such a world of difference, though, between the kind of like end results between those disciplines.
Mm-hmm.
But OA, from a medicine perspective, it's popping a pill. It's quite simple.
That's the Western world.
Yes. And there's very little commitment. Whereas rehab, I think people see as a bit of a boulder pushing it up the hill. You've got to do some significant changes. There's investment of time and energy and thoughts. You know, I've effectively got 3 broken dogs at the moment. It's just a bit of a nightmare.
Oh, poor.
And there's all that kind of and you're trying to modify your daily routines to meet their exercise needs.
Well,
it's hard work.
Yeah, that's the biggest deficit of all, right? The Western world, at least I could say for the U.S., most of the U.S. lives on convenience, right? And if it's not convenient, it's not feasible. Even though it is feasible, right? Convenience goes a long way for people, especially in certain demographics of the U.S., right? Yeah, some people will say, if you can give me a piece of construction equipment that'll push it up the hill for me and I don't have to do it, why wouldn't I do that, right? I don't want to push the boulder. So yeah, there's that mindset and breaking that mold too, because there's still too many people out there that just want the convenience and not the actual fix.
No, I agree. And I actually spend a lot of time thinking about this. I think my journey is heading much more towards like owner psychology, owner communication, and like the ethics and kind of welfare of what we do. And I've battled this question. I'll pose it to you and see what you think. So we know that stem cells, multiple joints, autologous fat harvest is probably the most effective, efficient. You're doing multiple joints. You know that you're going to have to go in a couple of times. So it's better to harvest, have it on store. So that's an invasive procedure.
Yeah.
So the animal has to go through an anesthetic and an invasive procedure to harvest that. And then every time that we apply those stem cells, there's going to be a sedation, maybe even an anesthetic. There's going to be a broaching of the joint. So again, it's another invasive intervention. But if we know that it does offer benefit, if that owner really has not got the interest to put in the additional effort in and surrounding the injection. Is it right or wrong to do it? So from the dog's perspective, they might go, look, I don't mind, stick a needle in, I get 6 months of, it feels a bit better. So that's okay. And then there's all these battles in my head of, if somebody said to me, I know that I won't do a rehab plan surrounding the stem cell implantation, would I then say definitely no? Or would I say, what does the dog want? I don't know. I haven't got the answers.
I'd not to say that I have one either, but how I do approach it. And I talk to them about, you're making an investment. So when any choice you make, whether it's the medical side, the rehab side, you're investing in what's going to happen. You're investing in the outcome. Part of that investment is you also interacting, right? I need you to interact in this investment for you to get an ROI, right? A rate of return. And that's the only way we're going to meet those outcomes, those goals that you're looking for, that you're investing in. So that's how I approach it. Most people they give me the nod. They say, yeah, you know what? That's totally right. And it does spark something in the beginning. Now, does it carry over for the whole time? I'd say probably not. That's a lot of times where, again, I put it on myself, especially when we do a reassessment or a reevaluation, we want to bring that back up, right? Okay, great. We're progressing. It seems like you guys are doing really great at home and you're really doing great with the rehab, the protocol. You're making every appointment. And I give them that affirmation of, you're doing good on the investment that you've created. Let's keep it up. And we're going to get to those outcomes and those goals. It's tough. And you can try to do it every time they walk in, but I can tell you that for me, I've just seen it more intermittently do it, because if you're doing it every time they're walking in, now it's the same tune and they don't always want to do the same tune.
It's very hard work.
And honestly too, I think for the practitioner, it's going to be, if you're saying the same tune over and over again, it's going to get to you as well. So that's my approach. I wish I could say it's 100% effective, but
it won't be, because we know that from human physiotherapy. In that, I think there's figures such as 33% of people feeling their own pain will not go after the first physio. So they'll go for their first physio assessment, even though they are in pain, they get a 33% dropout rate. And so the figures of people that continue going to these sessions or these prescriptive exercise plans is minuscule. And they're people that have got the pain. They're the ones that wake up at night when they roll over. They're the ones that can't turn their head left. They're the ones that don't go out socializing anymore because they're feared that they're going to be uncomfortable. So the likelihood that we're going to get higher returns than that on a situation where they can't feel their dog's pain, they can't potentially see the real subtleties of their dog's changing pain state. So it's going to be tough. But that gives me a chance to talk about my new service. I'm going to just do it anyway.
Go for it.
This is something that I'm really interested in, because chronic pain management in people, I think we can learn a lot from what's happening in the medical sector. And this kind of like psychology, this, as you say, this support service, this emotional kind of like big brother, hey, you got this. It's okay. Yeah, you're going to have down days. Pick yourself up. Come on. Is really necessary in the chronic pain world. So I was looking at one of the big problems that we have with our caregivers. And as you say, they come in, they have a 10, 15-minute consult and they can go back, but quite often they then chug into a 3-month assessment or a 6-month assessment, and motivation there, is there? There's no empowerment. There's no continual learning. I get probably 2 or 3 messages a day from people asking for advice. And I thought we could turn this into a teleguidance service.
Absolutely.
So it's in its infancy. It's very slow. I won't lie. It is slow off the mark at the moment, but it is really fascinating being that continuity of care for caregivers that are on the journey, and they do realize that they have the confidence. They want somebody that's going to give them a bigger picture, somebody that's going to be there to coach them and pick them up when they're the dog's having a flare and they're struggling with it. So maybe there's more service provision directed at the caregiver's needs and motivations rather than just focusing on.
I do think that's an awesome approach, because I think the long short of it is people want an ear to talk to. Like people want to say their frustrations. They want to say what they have to say. And then they want a rebuttal to where it's going to enlighten them, right? It's okay. And here's what you can do, right? It's a very comforting outlet. And I think it's great. And what I would say is good things take time.
Yeah.
Good things take time and step by step, right? One foot in front of the other.
I think it's something that will float eventually. Like Cam's taken 10 years. I look back and I do you know what? I wish I could have had a word with myself when I was in my living room back in 2013 going, oh yeah, this is going to be easy. I probably would, like big bad Scrooge, go, are you sure you want to do this?
Right.
This is
what were you thinking?
But what way? It's because I'm so freaking stubborn. I won't give in. Whereas everybody else would have said, actually, this is ridiculous. So it is going to take time. I know it's going to take time, but we have a community group that has about 18,000 caregivers at any one point. And their group's called Holly's Army. And we also have our member zone that's got a few thousand people, caregivers in it as well. So I listen and I read owner stories every day, every day. And struggling with decision making, struggling with caregiver burden, struggling with not being able to communicate with the people that make the decisions with you is a really prevalent problem.
Yeah.
So much so that I actually left a message for my mate and my nurse, Evie, saying we really need to look at how vet techs and vet nurses, they could be like a trained professional in every practice that isn't just attentive to the team's mental health concerns. We need to start making a care team member that's able to provide for our clients' mental health concerns. We should talk about caregiver burden and we should talk about anticipatory grief and how it can paralyze you and what you do.
Yeah.
And that is a really big component of what we see online in our owner forums.
Yeah. No, I agree. A lot of the education, when I do lunch and learns at general practice veterinary hospitals, I go over the disability model, and the overall disability is not just happening to the animal. It's happening to the pet parent. It's happening to the owner. And we have to approach that. And that's the reason why we always, in our facility, let the owner come in, let the owner participate, because it's another form of bonding that they're not able to do right now because they can't go, throw a Frisbee on the beach. They can't go to a dog park and let them just run free rein. So we have to try and give them another outlet, right? Or that psyche that's happening to them where they are a little sadder now. They're a little more depressed because they're not able to take their animal out where they used to go every day. We used to hike every day, 5 miles. And now we walk 5 feet. For them to let them do certain things in like the exercise room or aid them in helping us help them. Like they're controlling the underwater treadmill a little bit, obviously under our supervision, but like things like that and interacting with their pup again in a more physical and mental aspect is huge. It's so huge. So I totally agree. I think it's a great... I think
it's a really pertinent point for all the listeners as well, in that I definitely have experienced that if you say to owners, no, you can't do this anymore, and you do not give them a suitable alternative, you're wasting your breath because they'll carry on doing it. So if you say to them, I know your dog loves chasing the ball, I really would like you to stop doing that. If you end it there, they're going to be like, well, what do I do? That's what they do. Yeah. So you've got to go that extra step. And hopefully Cam can help some of your listeners, because we have lots of booklets like how to exercise a dog that can't do long walks anymore and that sort of thing, because it is more chronic pain management and rehabilitation is way more than dealing with the facts and the evidence. It's providing that owner with a path that they can see and they want to walk as well.
Yeah, no, I absolutely agree. And also for our listeners, I know they're going to be interested in the course itself at Northeast Seminars. So if you don't mind, could you dabble a little bit into that and what your approaches are?
It's really hilarious though, because I sit there and immediately shrivel into a caterpillar because it feels outrageous to write a course. I'm still Hannah that just qualified from university in my own mind.
All right.
The course basically is me emptying my brain, having been a vet now for 22 years.
Mhm.
I've worked in probably 50 odd practices, anywhere between 50 and 80. I can't even remember.
Okay.
I've locumed a lot. I've done sole practitioner. I've done
Yeah.
team. I've done emergency. So I've done lots and lots of different things, but there are themes that have continued throughout all different job roles, different areas, different districts, etc. And what I was finding is that I love all my referral specialist friends. I love them. I'm not joking. They're amazing. I could never do what they do. But they see a different client to who I see. And they have different expectations in their clients to who I am. I'm a first opinion practitioner.
Mhm.
And I have 10 to 15 minutes with this person that their dog's part of their life, but isn't their whole life. And they
Yeah.
haven't maybe got all the insurance and everything. So the course is very much aimed at first opinion practitioners that they know that there's the gold standard.
Yeah.
Great.
Yeah.
I ain't going to get there because I'm dealing with it live. So it's very broad. It covers all areas. It's not going to be a course. If you want to learn all the latest evidence about stem cells, it ain't going to be the course for you. This is a course that takes you on all the difficulties from trying to have effective communication about their dog being in pain, all the way through to those conversations about end-of-life care.
Yeah.
So it's quite extensive. I think it's currently about 17 modules. There's a hope that I've been told I'm going to split it into 2 if I add any more.
Okay.
But there's so much more that I want to it.
Yeah.
So yeah, it's called CanVP.
Yeah.
It's Canine Arthritis veterinary practitioner. It's for vet techs and vets. And I wanted to give you more than just facts. I wanted to give you hints, tips, monologues, different approaches for you to get the result that you want.
No, I think that's awesome. And I do think there's a true value in just that topic alone. And it's great that there's a course for it and that you're helming it, right? Because you have all this seasoned experience, even though you underestimate yourself. And I think it's a necessary thing because I don't think every professional has that outlet to have the courage to have the discussion, right? Have the words to say.
Yeah.
And it's tough sometimes. There are practitioners that unfortunately just can't just be right away transparent, can't just put it right on the dish and say, this is what's for dinner. Appreciate the fact that there's a course out there that can help, right? Not
Yeah. I'd like to see it turn into
but
I'd like to see it turn like into a qualification almost. Like I want to bring in my mates, so Paddy Mannion, the radiographic and CT and MRI imaging. And I want to bring in Sarah Heath to bring in more of the behavioral component. I want to bring in Cecilia Villaverde, more nutrition. But then you realize it's going to be huge.
Yeah. But a necessary thing, right? It's only becoming more prevalent. And unfortunately, it might become more and more of what it is. So we're going to need more and more, right?
Yeah.
So we're
For sure.
It's looking like we're going to have multiple parts then, Hannah.
I think we're going to have. Actually, that gives me a chance to talk about the Chronic Pain Symposium. So I fly by the seat of my pants most of the time because nothing has panned out as I expected. And instead of writing yet again another business plan, another ambition, I've done so many of them and they've never ever got past month 1. So I've been to all of them and I now just
Ain't that the truth?
Yeah. And I think that's okay. And I got asked, I met somebody last year that runs an online CPD platform and I just jokingly said, hey, let's do a conference. And I was like, oh, okay, let's do a conference then.
There you go.
So we did the Chronic Pain Symposium in April. It started off as 1 day and then it turned to 2 and then it became 3 and they started off as 8-hour days and they became 14. So we ended up having 14 hours a day for 3 days. And it went brilliantly. We had 6 girls and registrants and I couldn't have wished for more. We were able to bring in all different disciplines. There were people talking about the benefits of sleep, all the way through to nutrition. We had people talking about exercise, all the way through to how to entertain a dog that can't exercise as much.
Yeah.
It was brilliant. So, yay.
I love it.
God. Next year, it's going to be 4 days.
Oh, and 18 hours, right? No, I'm just kidding.
Yeah. And what's really exciting is everybody that we asked to speak. So we made sure that we had people team up. So for example, Kristen Kirby Shaw, my sister from America, she's absolutely incredible. she brought her mate, Lelani Alvarez, and they teamed up and they did one about
great.
exercise.
Yeah.
And then my friend Sarah Heath, she brought her friend Claire Rustbridge, and they did one about neuropathic pain and behaviour. So we had Duncan Lascelles with Masataka Enomoto. They did about young dogs. So we paired speakers.
Cool.
Cost, I think, our speaker fees.
Yeah.
But I contacted them and said, do you want to do it again? They're like, hell yeah.
Of course.
Hell yeah.
It sounds like you guys really hit the nail on the head. And why not do it again? If you know you can do it,
No.
why not do it again? That's very exciting.
Super.
Yeah, that is very exciting.
I love it because I feel like I've lived through the apathy towards disease, and I feel like I'm looking at some trees beginning to blossom with interest. Now, I'm young compared to some of my amazing CAM advisors. That Jenny Sarah Heath, okay, she was interested in clinical behaviour 30 years ago. 30 years ago. Now, I qualified 22 years ago, and I was expected to give behaviour advice in a 10-minute consult in a small little cubicle room for a dog that's just bitten 3 members of the family, you know? So just imagine 10 years prior to that, somebody saying animals have emotions and we should care for them. And she was female in a male-dominated profession at the point.
Yeah.
So I'm still a fledgling compared to those heroes, but it is beautiful to see people becoming more and more interested in this discipline.
Yeah. No, that's awesome. Congrats. And yeah, I'm looking forward to next year for you. That's amazing. But speaking of futures, let's talk about emerging trends and research that you possibly see or that we'll be seeing, anything like that.
Okay, so emerging trends, obviously, we've covered the young dog concept, and there is definitely a need to improve our diagnostics around young dog disease. I've already alluded to, is radiography going to cut it? And so Richard Meeson and his team at the Royal Vet College are doing much more kind of investigation of, is this going to be CT? Is this going to be MRI? Is this going to be ultrasound? What is going to enable us to detect early disease? And some really cool and available initiatives that we could start using now are things like activity monitors, thermography, the stance analyzers. We have got quite a few tools that are there. But when it comes to like confirmation, that's an area to keep an eye on. We haven't got a biomarker yet, for example. With regards to like things like surgery, when I was really just in my infancy of interest, the orthopedic surgeons that used to visit the practice would say, what about surgery in OA? And I was like, I don't really see how it fits. I never got taught that at university. And now they're really aware that if we can catch the disease earlier and it's because of an angular limb deformity or it's because of a developmental joint disease, are there surgical interventions that we can put in place earlier that really can change the way that joint is mobilized? So that's quite an interesting area. Obviously, we've started discussing about biologicals, and that's really competitive. And in that financial kind of market insight, that's what they stipulated. The growth in biologicals and regenerative and intra-articulars is really exciting for investors. And I think it's really exciting for us. We've got now the off-the-shelf products. So we could actually be the practitioners that don't just take the sedated x-rays. We go, I'm going to sedate, I'm going to x-ray, and I'm not going to wake this dog up as painful as it was and send it home. I'm going to do something whilst that dog's here. And then we've got all the progressions in the availability of tools. So every practice I know has a laser. Many of them are now like lasers that they rent out to the caregiver. We've got Shockwave making a real big availability. We've got
biggest fan of Shockwave. I used it in the human PT world, so I really love that it's translating in the canine world. I knew it was the equine world, but I do love it translating well in the canine world now too.
Yeah, and I think for me, being, again, the first opinion practitioner, it's always felt really daft that we would have an animal in, maybe just blood work, get it ready for sedation, we'd then have it on a table, be pulled around, get a joint x-rays, and then we'd send it home. And it's only had Domitor and butorphanol, and it next day goes to call me, I really, what did they do to me when I was at one? And I thought, I've always thought, they're daft. That is a window of opportunity. And now we've got these off the shelf products. That's cool.
Yeah, no, for sure. And I do think a little bit more education too, that this laser, these shock waves, they can actually be done right on the table too, right? Whether it's, just for that soreness of the pull around x-ray or post-op, like you can do that right then and there. You've done your surgery and now you can hit it with a laser and a shock wave and also send that, patient home. Hopefully some reduced pain because of that. So I think a lot of times the education isn't always put there, right? That, okay, you've just put the patient under the knife. You've done the surgery. It was successful. Now hit it with a laser and shock wave. And it's just going to expedite the healing in general, right? The superficial and the deeper healing in general too. So I think a lot of that education needs to be put out there as well. Yeah.
Yeah. So we might as well start, I know that we're coming to the end, but we might as well start now adding a bit of controversy.
Oh,
got to leave on a back.
I love it.
But so at this point, the more evidence-based practitioner in me would say we need to be striving to get greater evidence for all of these practices that we wish to implement because they're costly.
Yep,
some of them
absolutely.
are invasive. The real ethics and welfare consideration to what we're doing. However, I recently, in the last few years, have realized there's a lot of hypocrisy in our discipline.
Mm-hmm.
In that gabapentin, for example, is stocked in every shelf
Mm-hmm.
and it's used frequently with no concern. But the data to support its effectiveness is piss poor.
Mm-hmm.
Whereas we've got, as you say, the availability of, say, shockwave. And the evidence is limited, but there is arguably potentially more.
Mm-hmm.
We've got the nutraceutical world that they're doing studies that have got 70 dogs in it and potentially showing positive. The ones for gabapentin and Librela aren't much bigger.
Mm-hmm.
And I just sit there thinking, isn't it hilarious how we have different attitudes to what we use, how much evidence they need for it to be. And I don't know the answer at the moment.
Yeah, I mean, controversy is a good word. You never know what research is started and then shut down because of other faceted companies. But yeah, for me, being able to do physical therapy for humans first and seeing the evidence-based research there. Obviously, yes, animals and humans are very different, but there's a lot of similarities. And I do think that evidence-based research is something that in the human world is something that in the vet world should be looked at too. I'm not saying we should go off of it, but I'm saying it should be something to help the practitioner in vet rehab just to know a little bit better about this modality that, yes, unfortunately doesn't have a lot of animal research, evidence-based research to it, but there's so much in the human world. There's so many good papers in the human world on shockwave alone that I personally believe is better than laser, right? And that's a controversial statement right there, right? But I can feel the shockwaves now.
Oh my God, thanks. But it's also, the other thing that we've got to learn from the human sector is that once the evidence has been collected, that's not the end of the story.
Mm-hmm.
For example, paracetamol in lower back pain is falling from its little perch. We're beginning to have studies and meta-analysis that go, I'm not so sure it is that effective. And we've got the same happening with manual therapies in the human sector. So there is definitely more of a roller coaster, which leads very nicely. Then how can you be the best practitioner knowing that the world of evidence that surrounds you is actually quite flaky at the moment? It's got to be objective monitoring, hasn't it? And it has got to be, is this scientifically plausible? Have I clinically reasoned this with my understanding of the case, the animal, the owner, the tissue? Yeah. Is this the right thing that I could argue in court? And is it working?
Yeah. And I think the best thing for that practitioner is use what you know, and you might have to pioneer some things as long as it's safe and healthy for the animal. You might have to go a little bit against the grain, right? And I think it's, as long as you have the knowledge in front of you, you make that clinical decision and you get the outcome you want within safe parameters, healthy parameters for the patient. Some things you just have to go right instead of left. Yeah, always. And whether it comes to shockwave or manual therapies, and even manual therapies, I think are great. But I remember for me in the human world, we phased them out because it was the therapeutic exercises that's going to get you there and keep you there too as well. And that's a whole nother topic. But yeah, it's not, you shouldn't always depend on these modalities. Even your hands after a while, you want to use your hands to assess and you want to use your hands to palpate. But the manual therapies on the later phases of rehab can help every once in a while to give soft tissue massage and maybe, okay, a little joint mob needs to be here. But in the grand scheme of things, once you've got this patient in a particular phase, now it's the exercises, right? Now it's how you challenge them in a safe manner that's going to get them there and keep them there in the sense of longevity. And that's the goal of everything physical therapy or rehab, is to no longer come to physical therapy or rehab, right? Because you've been, yeah. So,
100%.
yeah.
Yeah. And then just with the pioneer thing, it just triggered a thought. There's a really good paper, but just like reading, by Robin Downing. So I think she's got a doctorate in bioethics. And it's all about the ethics of care in veterinary medicine, about beneficence, non-maleficence, and making sure that when you clinically reason what you're going to do, just you've got this crib sheet in your head of, will it do no harm? Will it do good? Is it scientific?
Yes.
So I'll see if I can dig it out, because that's a really nice kind of with yourself.
Very cool. And yeah, when we find it, we're going to definitely link it in the show notes for everybody. And so they can make the determination on that.
A ledge.
Hannah, this was an amazing conversation. I truly appreciate you joining us today. We're going to link all the information, that basically everything you're involved in our show notes. And yeah, this was amazing. I want to have you on again because I feel like we could still talk even more about vet rehab.
There's
in
so
general.
much.
Yeah.
It's a huge topic. And then this will make everybody feel better. My closing statement, when you're feeling really overwhelmed, which bear in mind, it's my kind of full-time concern, is chronic pain and osteoarthritis. I wake up every day going, I don't know anything. I can't remember anything. I can't recite it. I'm not one of those people that goes, Brown and Earl, 2012, decided that 8 joules per centimetre square just over the medial epicondyle. I'm not that person at all. Never will be.
Maybe.
And I was chatting to the infamous, Professor Duncan Lascelles, and we were in an airport, I think it was, and I was like, I just don't remember anything. He went, look, I used to have a really good grip on the topic, but it is growing at a rate of knots that I haven't got my finger on every pulse now.
Yeah.
And that's the truth. This topic is huge. So don't feel that you're not a great practitioner if you feel that you're running behind on areas. It's impossible. It's actually impossible.
Yeah, no, I agree. It might look like a tsunami from far away, but still try to surf, because you never know. It might be a lot smaller when it actually comes up to you. No, that was awesome. Thank you so much, Hannah. We will see you again soon. I can definitely say it. All right.
Thank you for having me.
Thank you. You've been listening to the Canine Rehab Movement Podcast. Thank you for tuning in. And for more information about our programs, please visit ncsuvetse.com. That's ncsuvetse.com. And for those of you who've made it to the end of the podcast, use the discount code NCSU100 and save $100 off of any course, $4.99 or more. Until next time, guys, this is the Canine Rehab Movement Podcast.